have to quit smoking if you're going to have surgery? And what risks do you have if you're a diabetic? Top spine surgeon Dr. Gosha Brusovanik has the answers for you. Let's take a look.
Surgeons and we're scientists, so we see the complications.
Right.
So the newer techniques are better. We've taken down the risk of non-union and risk of having to go back in from 36% down to about 3%.
It's amazing.
So it's a tenfold improvement. Infection rate is much lower now because the incisions are smaller. The risk of injuring other tissues is lower. So we didn't really discuss this, but I mean, there is a risk of bleeding, risk of neurological injury with surgery, and that has become significantly lower with these newer techniques as well.
But that's rare, correct?
Very
now
rare.
With these minimally invasive techniques you're
Very
using?
Rare. And especially now that we've learned to go to the front of the spine, the risk of non-union has now fallen significant. So I really couldn't even tell. It's probably in the range of about 1% or less than 1%.
I want to talk about the recovery after, because this is something that you've also brought up throughout the show, and the importance of recovery, first with not doing the heavy lifting, lifting from your back or not lifting from your back. So how much does this recovery matter in a patient's prognosis?
It matters. You know, when we talk about recovery, we have to put it within context of which operation the patient underwent. So if it's a discectomy, then it's a good idea to wait about 6 weeks before major sports participation or before sort of achieving new feats. So if it's something that a patient normally does, then it's reasonable, and I tell patients to use their pain to guide them. If it's a fusion surgery, the classic fusion surgery, these patients need about 6 months of rehab. They need to wear a brace, no lifting, twisting, no bending. I mean, that's really why I don't do these operations, because my patients expect better. The newer techniques, we have become a bit more cavalier at not restricting patients. So with these newer methods, no restrictions, no precautions, no brace, no therapy. They
no therapy?
No, nothing. They just kind of go back to their normal lives.
And you actually, from previous segments that we've done together, you like your patients to be moving around after surgery.
Same day of surgery, absolutely. So we have very good communication with the nurses, and we really ask the nurses to make sure the patient gets up as soon as possible after surgery, within a few hours.
Right.
That not only prevents the risk of a thrombosis, of clot formation, it also avoids the morbidity of laying down. And the older we get, the more this is an issue.
Right.
Even a day or two of laying down will cause loss of bone quality and other issues, pneumonias, urinary tract infections. Movement is very important.
Very important. Now, it's important to keep moving, as Dr. Brusovanik said, after surgery to help with the recovery. So check out this short video that explains tips for strengthening your back. Still time to call in if you have a question for Dr. Brusovanik. That number is 855-796-4475. Now, we were talking right before off camera, and we were saying how insane it was in the past that instead of movement, as we saw in that clip, doctor wanted you to have complete bed rest. And that's actually the worst thing you can do, especially after recovering from back surgery.
Yeah. Look, this generation and all the subsequent generations will never be hungry for information. There will be always a plethora of information. And we as practitioners have been taught to grade evidence. And I think that with time, the public needs to sort of understand to grade the evidence. We did, and by we I mean grand we as the physicians, we did a lot of ridiculous things to patients over the past century that had no value and would hurt patients, but did not have the know-how to prove them wrong. So look, if a doctor tells you his opinion, make sure you understand that that's an opinion. And when a doctor tells you what he knows, you got to understand that that's what he knows because of scientific basis. We always we ask a lot of questions as physicians that we may not have scientific basis for the answer.
Right.
It's important for the patient to ask whether the information that they're getting is legitimate information that's coming from studies, or this is just an opinion. And I think that will help clarify, because a lot of treatments that are offered are just nonsense.
Right. And as you mentioned, sometimes they come in for something that they may not need, and they need a second, sometimes even third opinion.
You got it exactly.
Wow.
It's never wrong to get a second or third opinion. And look, I have a website that actually tries to sort of dispel some of the myths and look at some of the research. So it's called spinedoctormiami.com. Spinedoctormiami.com. There's some videos there for various conditions that hopefully will help clarify some of the inconsistencies.
And then we also have a list of some ways patients can lower the risk for surgical complications, as we've been talking throughout the show. So can you walk us through these, Dr. Brusovanik, which is, you've been saying this one, communicate with your doctor.
Yeah, that's above all else. And make sure that before you go to battle, meaning before you let a surgeon operate on you, this is not a type of a person that you can't reach. This isn't someone who is difficult to reach. And this is someone who's going to be there for you. You know, if your pre-surgical appointment, you're already getting the cold shoulder, things will only get worse.
No.
And when you need that doctor, you got to make sure the doctor will be there for you. Of course, verify your medications. Absolutely. No one is going to be as much of a leader for your care as you, the patient. So make sure that your medications are safe for that operation. Make sure you're not taking anti-inflammatories, which can thin your blood. Make sure you're not taking medications that are going to interfere with anesthesia medications. Keeping wound clean is important.
Okay.
And I would just follow that surgeon's sort of guidance in terms of how he likes his wounds to be covered. I like to use a multi-layer closure and then glue on top, and then a waterproof dressing on top so patients can shower immediately, and it's sort of low maintenance. Smoking, that's an obvious one. And if after surgery you're sneaking in cigarettes, you are endangering the hopefully good outcome.
And you're putting yourself at risk for probably thrombosis, correct?
Well, actually, that's a great point. So there's been evidence that showed that especially in women, and especially women who are taking birth control, if they are also smoking, their risk of thrombosis becomes sky high.
Right.
So there's just no reason to smoke anymore.
Dr. Brusovanik said there really is no reason to smoke anymore. And I've learned anything from the Health Channel, it's that smoking can lead to so many problems down the road. So quit or don't start.